El IICA le da la bienvenida a este evento y agradece su participación. Estas son algunas recomendaciones para mejorar la calidad de la videoconferencia. Habilite su micrófono solo en el momento que le den la palabra. Es importante mantenerlo en silencio cuando otra persona está hablando. Por favor, tener encendida la cámara en todo momento para que otras personas lo puedan ver. Si necesita atender algo personal, puede apagarla y encenderla al volver. Agradecemos por favor poner en silencio sus teléfonos celulares para evitar alguna interrupción en la videoconferencia. Recomendamos cuide su postura y su posición frente al computador. Para esta reunión contaremos con interpretación simultánea. Es muy importante que cuando ingrese al enlace de Zoom del idioma de su preferencia, debe hablar en ese idioma. Por ejemplo, si ingreso al enlace de español, debe hablar en español en todo momento. Al finalizar el video, les pedimos el favor de hacer silencio durante 30 segundos. Una vez finalizado ese tiempo, el moderador o conductor puede iniciar la reunión. Muchas gracias por su atención.
Welcome, everyone. It's a great pleasure for me, Rika, here to welcome you all to this amazing webinar. Very interesting. If work in food safety, great model. It's my pleasure. I'm the country representative for Rika in Canada, based in Ottawa. This is our third of three webinars this year, and it's always a pleasure to partner with the CFIA. Today's webinar is a really great model to demonstrate an online platform and the collaborations with the federal government and subnational governments. So you'll see that collaboration come through in the presentation. And for me, when you work in food safety, really, if you work on risk assessment, risk management, and risk communication, that communication part's really, really important, which is what we'll be discussing as well today. So I don't have much to say except for a reminder. If to stick to a language, you can pick the globe at the bottom. In Zoom, you'll see there's a globe. You can stick to understand English or Spanish or French. And we thank the interpreters in Costa Rica for coming through last minute for us. And that's it from housekeeping, I think. Over to you, Marie-Pierre Mignot, our colleague at CFIA. Cheers.
Thank you, Jean-Charles, for these kind words. It is always a pleasure to collaborate with ICA on those webinars. We always like suggestions on topic of interest to you. So it's always a pleasure to be here. So welcome everyone to this Canadian Food Inspection Agency's workshop. My name is Marie-Pierre Mignot. I am the National Manager of the Technical Cooperation Unit of the International Affairs Branch at the CFIA, the Canadian Food Inspection Agency. My group is in charge of coordinating technical cooperation activities that falls under the Canadian Food Inspection Agency's mandate, which is to say animal health, plant health, and food safety. So we have a full program today with two very interesting presentations on key aspects of the CFIA work. The first presentation will be done by my colleague Penelope Baker from the Food Science Advice and Intelligence Division, and Penelope will provide us with an overview of this Canadian Food Safety Information Network, CFSIN. Then we will have a presentation on CFIA's approach to risk communications by our colleagues Melissa Leclerc and Jessica Turner from the Risk and Emergency Communications Group of the CFIA. So I'm extremely pleased of the good collaboration we have with ICA, which led to this workshop being broadcasted to ICA's member states today. I hope that the information we're about to share with you will be useful, and there will be some opportunities to ask questions after each presentation. Please do not hesitate to ask for any clarification. If after the webinar you also have questions, please reach out to either myself or our colleagues from ICA, and we'll be pleased to follow up on these questions. So without any further delay, I would like now to pass the microphone to Penelope for a presentation on CFSIN. Penelope, the floor is yours.
Thank you, Marie-Pierre. And thank you also to the organizers for inviting us to present to you today. And also thank you to those who are participating and are here today. My name is Penelope Baker, as Marie-Pierre indicated, and I'm a member of the CFSIN, or the Canadian Food Safety Information Network. In particular, I am involved with stakeholder relations. Our plan was to have myself and Brigitte Cadieux co-facilitate this presentation. Unfortunately, she has lost her voice, so it'll just be me today. Our apologies for this. What we will do is we'll provide you with a high-level demo of the CFSIN and its tools. So as I said, that'll probably take roughly an hour, and then we'll leave some time for questions. Now, when we talk about the Canadian Food Safety Information Network, we like to start by giving you some information about the background. So I'm going to bring you over to the deck. I'm going to share my screen. So CFSIN began as a result of the listeriosis outbreak that took place in Canada in 2008. So this outbreak was the most significant documented food outbreak in Canada, and unfortunately, it led to the death of 22 Canadians. One of the factors that contributed to the magnitude of this outbreak is the fact that in Canada, food safety is not centralized. So it's a shared responsibility between federal departments and provincial and territorial authorities. So what happens, each jurisdiction conducts their own activities to support their food safety mandates. And although these different players work together to some degree during multi-jurisdiction food safety events, there was no formal network in place to facilitate the timely exchange of information between the different groups. So CFSIN was created to fill this gap. Essentially, CFSIN brings together the different food safety authorities among the federal, provincial, and territorial departments, and enhances collaboration, as well as the timely sharing of information, resources, and data. In terms of outcome benefits, it's very much focused on promoting earlier detection of food safety risks and encouraging the timely sharing of food safety information to improve prevention and the mitigation of these risks, as well as the response to food safety hazards to better protect Canadians. So there are many different groups that are involved in CFSIN. The initiative is led by the Canadian Food Inspection Agency, who is responsible for inspecting and enforcing federal food safety regulations for both domestic and imported foods. Other federal groups involved in CFSIN include Health Canada. They are responsible for establishing policies, regulations, standards, and guidelines related to the safety of all food sold in Canada. We also have the Public Health Agency of Canada, who conducts outbreak surveillance, and they also lead the coordination of the investigation and the response to multi-jurisdictional foodborne illness outbreaks in Canada. Of course, we have also Agriculture and Agri-Food Canada, which we consider our parents to CFIA, and they play a role in terms of what is mandated to support agriculture and food processing. We also have provincial and territorial government organizations. So typically the food safety mandate within these jurisdictions is led by either the Ministries of Health or the Ministries of Agriculture. It just depends on the jurisdiction. The network includes food safety specialists, public health officers, and food testing laboratories. So CFSIN, what it does is by linking all of these groups together, there is a broad network of experts involved in food safety, and mechanisms are in place to improve information sharing and collaboration between all of these experts. Now that speaks to the people side of the network, but we also have what we refer to as the CFSIN technical solution. So essentially, CFSIN also provides a suite of 5 digital tools that links together the members of this network across Canada. This platform was launched in September of 2020. So the tools within the platform are designed to support collaboration and facilitate information sharing between the FPT partners, and also allows access to a pan-Canadian repository of food safety surveillance testing data. So together, these tools enable our partners to work together to proactively detect potential food safety issues. So I'm going to pause here, and what I'm going to do is bring you over to the CFSIN platform. So we refer to it as the CFSIN portal, and it's a Government of Canada web-based platform that allows users to collaborate and share food safety information quickly and securely. So in order to gain access to the portal, CFSIN users need to complete a registration form. And once they're registered, they are provided with a link to this portal, which is not public facing, and this allows them to access the various CFSIN tools. So what you see on this landing page or main page is a tile that's dedicated to each of the 5 CFSIN tools. And they include environmental scanning, laboratory mapping, intelligence, event management, and collaboration. So once you're in the portal, you can jump directly into and out of any of the tools that you have access to. If you scroll down to the bottom, you'll see a series also of white tiles. The first one is the CFSIN directory, and it lists the current registered users according to their organization, their role within their organization, as well as some contact information. We also have a section for CFSIN resources, and these include things such as a 15-minute CFSIN platform overview video that users can watch on their first visit. And we also put up here user guides on how to use each tool of the CFSIN. So these are very extensive step-by-step instructional manuals. So let's visit each tool briefly, and we're going to start with environmental scanning. Before I bring you into it, I just simply wanted to say that environmental scanning is an online search engine that scans more than 10,000 open sources of information, making it easier to stay up to date with emerging risks from either food, plant, or animal hazards around the world. More specifically, it's a web crawler that finds publications, including media articles, academic journals, blogs, and social media feeds such as Facebook and Twitter, based on your filtered search using different criteria and keywords. So let's go in and take a look. So this is the main landing page for environmental scanning. If you look at the top, you'll see the filters results section. So this is a section that allows users to build their search with drop-down selections to help pull in the type of publications that they are interested in seeing. So I'm going to run you through a fairly quick example. First thing that you're able to select is your time frame. So for example, here, I may want to look at the publications that came in within the last 7 days. I'm going to look at category of food, and then I'm going to want to bring in a keyword here. And I'm just going to pause for a second before I bring in the keyword, which I want to bring in listeria. So in collaboration with the Canadian FPT partners, 54,000 keywords were developed that tag all the open media sources included in this search engine. And they also help to contribute to the machine learning algorithm of the tool. So once I start typing in the word listeria, it starts populating, and this is what it's going into, these 54,000 key search words. So I want it as a hazard. So I am going to bring in listeriosis and conduct now my search. So within the last 7 days in the category food looking for listeriosis, the system has found 4 entries. Now, before I get into the information at the bottom of the screen, what I wanted to indicate is that the tool also gives you a visual representation of your search query by producing a dynamic map. So this map shows you the concentration of locations within the publications, and you can drill in or drill out. And over here to the right, you are also provided with a chart. So you can see how many articles were tagged in a location over time, or you can change this to reflect by region, by category, or by keyword. At the bottom of the screen, as I mentioned before, this is the section where the articles that match your search criteria are listed. There's some brief information given on each article. So you're looking at the date that the article was brought into the system, the title, a conversation bubble. So if a comment was posted about it, the publication name, the source language. So the system can detect up to 9 languages and translate into English. The category that it tagged it to, so be it food, animal, or plant, and this relevance score. So the system assigns a relevance score between 0 and 1, with 1 being considered as the most relevant. So in addition to finding articles of interest, the ES tool also allows you to save your search query. So what you've inputted here at the top, that's in the event that you'd like to run some routine scans, as well as exporting your publication list that you find here at the bottom as a CSV file to import into Excel. And you can include additional columns if you want to do more analysis on the information that you are able to find. So next, let's have a look at laboratory mapping. So this tool consists of a centralized directory of pan-Canadian food testing laboratories that food safety authorities primarily deal with. So in day-to-day work, laboratory mapping gives users access to the expertise of other laboratories and colleagues to either share best practices or to collaborate on projects. It's also used to rapidly identify and mobilize laboratory surge capacity and capabilities during food safety emergencies. So when you come in, at the top here, what you see are some drop-down filters. And this is so that users can easily find appropriate laboratories that have the capabilities and the capacities that they're looking for across Canada. So for example, you can search for a laboratory according to commodity, or you can search according to hazard. And again, you can search according to function or expertise at the laboratory. If you're more visual like me, or if the location of the laboratory has some significance, we also offer a lab here. So you can click on a location indicated in the map, and the information related to that laboratory then shows up in this laboratory panel, laboratory details panel here over to the right. So every laboratory in the directory has a profile that includes things like general information, location, contacts, testing capabilities, expertise, and information on capacity. So you can scroll down and see that information. Everything that matches your search also gets listed at the bottom here in your laboratory listing window, and also includes direct links to the laboratory's website, as well as indicating their accredited methods. So let's leave here and move over to the intelligence tool, which is here. So the intelligence tool is novel in that it's Canada's first hub that brings together all of the food safety surveillance laboratory testing data from the CFSIN data sharing partners. And we have come to call it the Pan-Canadian Integrated Food Safety Repository. In order to build this repository, data is harmonized based on the CFSIN data standards, including the food and hazard classification systems, which were developed in collaboration with our Canadian FPT partners. It's also important to note that this particular tool requires special permission to access, and that only those CFSIN organizations that have signed the data sharing agreement can view the food safety data. This is to ensure the confidentiality and the terms of use of the data shared by the partners. So we'll click, we'll bring you in. So this is the main page for the intelligence tool. Integrated data, which include both microbiology and chemistry standard reports. So I'm going to click on the dairy product report. And before I get into the data, I wanted to indicate that all standard reports are structured in the same way and that there is an information tab. So in this section, we provide summary information, definitions, the assumptions regarding the report, and then there's the results tab. So results are displayed. The results displayed are divided into information about the samples over here to the left, and then information about the testing of the samples. Now, what's really neat about this is that because the reports are produced using Power BI, you can filter and drill down and slice the data as you wish. So, for example, here we're seeing all the dairy products. But if I want to come in and click here and show the breakdown of the different subproducts within dairy, then I can do that. And all the results change accordingly. So if I look just at the cheese and I want to break down cheese further, then I can click on cheeses, and then you see all of the other data that changes accordingly. So it's very dynamic. Now, if I clear this filter and I decide that I'd rather look at the country of origin for the samples, so for example, United States, I can come in and then it'll show me just the data where the samples of the food products are country of origin. I can do the same for Canada. If I clear the filters again, and let's say I'm interested in a particular moment in time or a specific period, then I can also change my dates and then show data according to particular time that I might be interested in. So now let's go back and have a quick look at event management. So event management is a tool designed to support information sharing and coordination among FPT food safety authorities and experts when managing an event across jurisdictions in Canada. So specifically, it manages information, communication, and sample collection activities in a secure place to help streamline the response to Canadian food safety events. So I'll click on event management. And this is the landing page for event management, which shows you a list of events that users have access to. So users only have access to events they have either created or been invited to participate. So for example, this is just my list of events that I'm able to see in event management because I've either been invited to participate or I have created them. So clicking on a specific event brings you to the details section for that event. So the tool is designed to capture all the information which goes into a food safety event from start to finish. At the top, you'll see a process bar. So this shows participants where the event is at in the event process based on simple list of key information that the event coordinator provides at each phase. And these serve as reminders to help keep track of key event details. So for example, with respect to getting a check mark here for the initiation of the event, the coordinator has to indicate that the trigger for the event has been entered and that they have added the required participants for that particular event. So below the process bar are tabs that open to specific sections where details about the event can be entered. So for example, in this main first tab, event information is where you would indicate the event type, and of course the trigger. This is where you bring in your participants. And when participants first come to the event, they will see important key messages about that particular event, which gets posted here. Quickly, I wanted to indicate a couple of the tabs within here because I don't have enough time to go through all the different tabs. But with respect to the food product details, this is the section where you bring in the food commodity that's involved in the event. And this particular section of event management is linked with the CFSIN data standards. Same with the area of concern, which is also known as the hazard. So in this particular example, it was Listeria monocytogenes. And again, this links to the hazard classification system of the CFSIN data standards. The most important thing I can tell you about the event management tool is that its hallmark is really in how it can handle complex sample planning designs. It doesn't happen in all cases, but in many cases, food sampling is required. And so the system will allow you to incorporate many sample plans whereby sample collectors or inspectors will go out into the field and go to the different retail stores or establishments to collect the samples. And what's very unique about this is that, for example, if I click on one of the sample plans here, and I come over to the collection progress and map view, the event coordinator can immediately see that there have been 2 store visits and that in this particular sample plan, we're looking for 10 samples and it's indicating that 10 samples have been collected. This information gets loaded almost in near real time. So at any time, the sample collector is able to go in and see exactly where the sample collection process is at, or if things need to change quickly. So we're going to leave event management. And we're going to talk about the 5th and final tool of the CFSIN, which is collaboration. So collaboration is the tool that ties all the CFSIN pieces together. Hence, it's the biggest tile on the landing page. It leverages the MS Teams application and gives users access to a community of food safety experts across Canada. So Probably many of you are aware of the capabilities of the MS Teams application, but specifically it allows users to ask food safety questions using the chat feature, share files and reports, establish special topic channels or communities of best practice, share screen to facilitate demos. So for example, we use it to deliver interactive training or to contact a user in a particular jurisdiction quickly in a secured space dedicated just for FPT partners. So I'm going to bring you in. So when a CFSIN user is registered to the CFSIN, they get added to 2 different teams within collaboration. So there's a general CFSIN team that gives users access to the entire CFSIN community. And then there is also a team in CFSIN that is just for users of one particular CFSIN organization. So for example, I am from CFIA, so my CFSIN organization specific team is CFSIN CFIA, which means other CFSIN users from other organizations cannot see this team here, but everyone can see the CFIA general team. So within this broader team, we have dedicated channels for specific topics and groups that have been created either by the CFSIN team or CFSIN users themselves. And channels that all the CFSIN registered users can access, but by that, not to clarify, anyone outside of CFSIN would not be able to access these channels. They're known as public channels. Some of the public channels that have been created include environmental scanning. So here, monthly reports developed by the Risk Intelligence and Outreach team in the Food Safety Science Directorate of the Canadian Food Inspection Agency are posted for all CFSIN users to access. And we have received positive feedback in that these reports are extremely useful and popular with our CFSIN partners, especially with those who don't necessarily have the resources to be able to do environmental scanning themselves. I just wanted to quickly bring you in terms of showing you a quick snapshot of what these particular reports do look like. So this is for January. So one of these reports is produced every month. I have a feeling my system's not going to cooperate. Apologies for that. Another channel that's been created is a surveillance channel. And this is where users are encouraged to share surveillance planning activities or to post surveillance resources that they already produce within their jurisdiction for the use of others within the CFSIN community. However, what's even more important with respect to this channel is that it helps partners to get a better sense of what other Canadian FPT organizations are doing in terms of surveillance across Canada to help them maximize resources and efficiencies. We also have a food fraud channel. And in this space, we encourage users to ask questions and share relevant information, as well as help foster collaboration on priorities related to food safety and misrepresentation. We also have an outbreak investigations channel, which was created by a CFSIN user in Yukon to share information and resources related to outbreak investigations. And this is things such as the binomial probability tool to help with hypothesis generation during foodborne disease outbreaks and the foodborne 2015 report. In addition to the private channels, public channels, we also have private channels. And these are denoted by the little lock boxes. And these are channels where only the CFSIN users that have been invited to be included in these channels have access, so not the full CFSIN community. These channels allow for specific users from different organizations and who are members of working groups or committees to share meeting materials and come together to carry out their activities, including co-authoring documents. So for example, we in CFSIN use it for our CFSIN management board. All the meeting materials, agendas, records of decisions are posted here and easily accessible by our CFSIN management board members. And we also have what we call CAST Subcommittee 1 group that leverages CFSIN to conduct their activities too. So CAST is the Cellular Agriculture Science Table, and they are working on pre-market safety guidelines. And so their activities, they conduct them in this space and work on co-authoring documents together in this space as well. So let's return to the portal for one last look. The final thing I wanted to say is that CFSIN is backed by a dedicated support team to respond to user needs and continues to improve and expand the tools. So users can contact us directly by using this white tile here at the bottom. I'm going to bring you back to the presentation and just provide you with a bit of a conclusion. So becoming a CFSIN users comes with many benefits. For example, users will gain access to the network of subject matter experts from 16 different jurisdictions. They can ask questions, get answers, organize collaborations, develop communities of practice, all while using the network. Of course, users get access to the CFSIN digital platform. So through this, they will get access to high quality information from across Canada. And for those organizations who have signed an MOU, they will have access to the integrated Pan-Canadian data repository. Through the use of the CFSIN tool, users will also be able to monitor the food safety landscape and proactively identify potential food safety issues and any emerging risks. With laboratory mapping, CFSIN also allows users to identify surge capacity in the event that an emergency situation prevents them from accessing their usual lab, or that a volume of samples to be tested is too high. Finally, with event management, users are provided with the ability to exchange information during a recall or an outbreak among all partners involved in the event, and also to coordinate any type of food sampling that may be required to support the response to such an event. So overall, we have had multiple achievements over the last couple of years since the platform was launched. We now have a large number of users from 35 organizations, and we have representation from all the 13 provinces and territories in Canada. 11 partners have signed the MOU to access the CFSIN data repository. And we have data in our data repository, and this data comes from all the 5 major data contributing partners. So more data sets are being uploaded as they become available. The CFIA has shared over 40 risk intelligence documents. So those monthly environmental scanning reports that I was mentioning in the collaboration tool. And with that, also 2 documents specifically on food fraud. We have an increased number of working groups who choose to use the CFSIN platform to share information and meeting materials among their group through the use of the private channels in our collaboration tool. And we have a management board in place, which includes representatives from most partner organizations, and they provide guidance on CFSIN priorities, as well as make decisions related to the maintenance and the expansion of the CFSIN. I would be remiss, however, if I didn't mention that we have faced a few challenges. One of the biggest setbacks that we've faced is the time and effort required to prepare the data for uploading into our data repository. So within the data sharing partners, we've identified what are called data stewards, and it's their responsibility to align their data or map their data to the data standards and upload it. But what we've noticed is that much more time is needed than anticipated for the data stewards to complete this work because there are a lot of manual steps. So it's complex and it's a very time-consuming process. Another challenge we've faced has to do with putting in place the data sharing agreements, or as we call them, the memorandum of understanding with the partners who want to access the data repository. So as I previously mentioned, an MOU has to be in place with each organization who wants to access the data. And each MOU is slightly different from one organization to the other, even though we try as much as possible to maintain equivalency. So this has been a challenge because negotiations involve our CFSIN staff, our CFIA legal team, the interested parties, staff, and legal teams as well. It's a lengthy process, and it's dependent on the availability of the partner. So if they don't have time to continue the negotiation, then this creates delays in finalizing the MOU. And admittedly, sometimes this is seen as a deterrent because this is a step that requires significant effort and time. The fact that our partners are dealing with competing priorities has also been a challenge. So by saying this, I think I need to specify or point out that participation in the CFSIN is voluntary. So this is where challenges with respect to competing priorities comes in. So as we know in the last few years, because about a third of our partners involve public health, they have been working on the COVID response. Also, our partners are faced with some of our partners are faced with natural disasters. For example, in BC, they're dealing with forest fires, they're dealing with flooding, and these are just some of the examples. So partners don't necessarily have the time to prioritize CFSIN activities. So in particular, the mapping of the data and the MOU negotiation, and this results in a lack of engagement and delays in adopting CFSIN. And as a consequence, it impacts the success of the CFSIN initiative. Finally, although we do now have 375 plus users, we are still noticing that most users don't use CFSIN on a regular basis. So we really want to get users to the point where they use the network in their day-to-day activities. So clearly, we still have some work to do, but that's okay. We're up to the task. My motto is always slow and steady wins the race. And to conclude, I just wanted to list to you the members of our CFSIN team, as well as our contact information. We encourage you to reach out to us at any time if you have any questions, or even if you just want to learn more about the CFSIN. We gladly answer any questions or be happy to provide you with that additional information. So on that note, I'd like to thank you for your attention. And as I mentioned, we'd be happy to answer any questions.
Thank you very much, Penelope, for this very good overview of what the CFSIN is, and what a useful tool it is. We've had a couple of questions in the chat which were answered. We do have someone in the attendance who has raised his hand. So I don't know if we can give the speech to that person. Okay. Senor Garza, you can ask your question live if you want.
Yes, thank you very much. I was wondering if or when we will be able to search the database and information you have in the platform.
Thank you
Thank
very
you.
much for that question. Yes, and we very much anticipated that question. So I guess the first step is in that is, you know, when will we be in a position to start inviting international partners to the CFSIN network? So all of that to say, we are working towards it. It is actually a long-term objective for the CFSIN. It's one of our performance indicators, actually. But, you know, we're still working, as I mentioned, because some of our challenges, we want to fine tune the system. We need to make sure first that, you know, we have our Canadian partners accessing, using the network on a day-to-day basis. And then from there, growing sort of the scope of membership outside our FPT family to include, you know, academia, industry, international partners. And at that stage, then, you know, having a discussion with the partners to see how do we go about sharing the pan-Canadian integrated data repository with all the partners. So it's still a ways yet.
Thank you very much, Penelope. It's a work in progress, but it's getting there.
Absolutely.
I don't know if there's any more question. Please feel free to put them in the chat or just raise your virtual hand so that we can unmute you and you can ask the question. Seeing nothing. And again, if you have questions, you further think about what you've seen today during Penelope's presentation, and you have a question that comes to your mind, feel free to reach out and we would be following up. It would be easy to do, and we would be pleased to follow up. So thank you, Penelope, and thank you also, Brigitte. I want to apologize. I didn't mention your participation when we started. I'm sorry that you are feeling sick today, and I hope next time you can be with us and present. So without any further delay, we will now go to the other presentation from Melissa Leclerc and Jessica Turner, who will talk to us about CFIA's approach to risk communication. So Melissa and Jessica, the floor is all yours now.
Thank you, Marie-Pierre. Hi, everyone. As Marie-Pierre mentioned, my name is Melissa Leclerc. I am the manager of the Risk and Emergency Communications Unit within the Communications and Public Affairs branch. I'm joined by my colleague, Jessica Turner, who is our resident risk communications expert and senior communications advisor. And before we jump in on the importance of risk communications, how we apply it here at the agency, let's look a little bit about how the changing communications landscape for context. So if we're looking at how we can't help but be aware that we're kind of operating in a quickly changing media environment. I'm sure you've noticed it as well. But the way in which public communication and media is consumed, produced, and distributed is constantly in flux. How we deliver communications has to adapt. So here's what we're seeing, and I'm sure you see the same things that we do. In terms of audience engagement, it is increasingly difficult to kind of maintain the attention of our audience, let alone their engagement in our content. We're constantly, as individuals, being bombarded everywhere we go with traditional news, social media, the plethora of platforms that exist. So how do you get those eyeballs or the right attention on your message? In addition to that, there's in a Canadian context, we are dealing with different priorities, right? So many Canadians are dealing with different socioeconomic issues, high cost of living, increasingly extreme weather, health and healthcare, and the economy. So it's becoming more difficult to reach Canadians and for them to be receptive to new information regarding issues impacting their health and safety. Media fragmentation. So as we continue to see, there's changes to traditional media models and evolving and ever-changing social media platforms, including the changes in the social media itself and the tools that we can use. So the way in which the government has traditionally relied on news media to support the distribution of news to Canadians is changing. Newsrooms are becoming smaller, they're more centralized, they're less local, which kind of has to change the way we approach either interviews with media responses, and other communication tactics. Public trust. So overall, what we've seen in surveys and studies globally is we're seeing a change in the trust of folks in traditional institutions like governments, like traditional media. It's constantly declining. Our traditional communication tactics are no longer as effective without trust. And if individuals are struggling to trust traditional sources, where are they getting their information? And this kind of leads us into mis and disinformation. And Jessica will go through that a little bit later. But we've noticed from our Privy Council office, they did a public opinion research, and the data from this shows that 1 in 5 Canadians acknowledge finding it difficult to distinguish between true and false information. And a lot of folks think that the internet and social media have made it easier to manipulate people with false information, and they're not wrong. So unintentional and intentional, sometimes malicious, sharing of that untrue information can have dangerous and unintended consequences. So it can be a major threat to democracy, and it makes it more difficult to access that timely and accurate information. The spread of wrong information can lead to policy failures and have consequences on the health and safety of your target audience. And while people sometimes don't maliciously share that false information, there are bad actors that do that. It can be either just to gain some clout or gain support for policies, spread their own ideology, or actually just profit from folks. The Government of Canada has published a lot of information on disinformation efforts related to foreign policy, which do have real world impacts on Canadians' lives. And there's also a lot of great work being done on an international scale on this, such as the World Health Organization, the World Organization of Animal Health, and Interpol. So we have a slide later on with some great resources that we encourage you to check out. And Government of Canada coordination, our mandate has a lot of connections with different other government departments. So it's important for us to work with, for example, Public Health Agency of Canada, Health Canada, Environment and Climate Change, Agriculture and Agri-Food, because we are all communicating under that umbrella of One Health. Increased coordination and alignment is required to ensure that we have kind of that whole of government approach to support health and well-being of our audience, Canadians. We need to ensure that we're giving all the same advice, that we have a cohesive messaging, and that we show that our evidence and policy are evidence-based and rooted in science. And so no one will differentiate different departments and agencies. We're kind of one entity, and we don't all need to speak from that Government of Canada voice. So for the next few slides, I'll turn it over to Jessica, who can take us through the presentation.
Thanks so much. So before we get further into it, we can talk about the importance of risk communication. You might have heard it, it's really top of mind these days. As Melissa noted, especially with the proliferation of mis and disinformation. And while we're working to, respond to global health and climate issues, a lot of other intersecting things that are arising. So risk is a really big word that can have a lot of different meanings for a lot of different people. So just within the agency itself, we have establishment risk-based assessments, integrated risk management, risk tolerance, chief risk officer, and risk-based decision-making. So, risk communications, how does that differ from that? Well, it can encompass a lot of different meanings, but in this presentation, when we're discussing it, we're discussing a specific communications methodology. So it's different from crisis communications, different than proactive strategic communications or emergency communications. So what is it and why is it important? Why is it important? Why are we hearing it everywhere? Basically, because our world is changing faster. Health and climate are very interconnected. We see that in the One Health concept, which we'll talk about a bit later. But at the heart of risk communications, it's really to give people the information that they need to make the best decision possible for their health and for their safety. So the aim is to provide the audience with valuable information and insights, which means informing people even in times of uncertainty. So if you don't have all the information, traditionally, we would wait and we would assemble and wait until we were sure before we would come out with, external information. Nowadays, things are moving so quickly, and it's regarding the health and safety of individuals that as soon as we know something, it's in our best interest to say something. So it really is aiming to help people and arm them with the information that they need to make well-informed decisions so that they can do their own effective risk management, both for themselves and for their families. So common examples of risk communications that you're probably well familiar with, it can range from anything from vaccine health advice or vaccine campaigns to labels on products, labels on cigarettes, on alcohol, to anything in between. So to successfully do risk communications, we need to use a multidisciplinary approach and break down existing silos. So a lot of the environment in terms of health and science is very siloed in terms of specialty. And so our goal and part of our work is helping to bring those together and weave them together, because at the end of it, we're all interconnected. So subject matter experts really need to work with communicators to help identify trends, hypothesize any potential scenarios, and highlight opportunities that may support a strategic communications response. Sorry about that. So at the CFIA, we do have a shared responsibility to inform Canadians about issues impacting their health and safety. And that's sharing information when we know it. So we can understand it can be a challenge to do proactive communications regarding scientific topics. There's a hesitancy to be definitive as the science often changes. It's complex, but in our quickly changing world, we have a responsibility to communicate with people about the risks to their health and to their environment as quickly as possible to reduce any potential harm. So risk communications really takes into consideration and works to inform individuals or stakeholders about the existence, nature, form, severity, or acceptability of the risk. It's required when the outcome of an event is unknown, unpredictable, or uncertain. Communication is and can be used as a primary tool to support policy implementation. So that's often missed in a lot of our discussions. But communications is really only as successful as the policy that is trying to communicate. So if the success of the policy is dependent on a behavior change from the audience, then communications does play a role. And it's our roles as communicators to effectively inform individuals about the consequences of not acting. For example, if we know that one—
Jessica,
yeah?
Sorry, your slide is not passing. We have on the same slide that you were before.
That's okay. I went, we're not there yet. Thank you though. So communications is and can be used as a primary tool to support any policy implementation. So in terms of, if we're asking people to limit the risk of transmitting an infectious animal disease by implementing a simple basic biosecurity practice through behavior change, then it's our responsibility to communicate that. So with our colleagues at Health Canada this year, we worked with researchers at Ottawa's Carleton University to look at the state of health and science communications in our current environment. So with that report, we worked with two fantastic researchers. So that's Gabriela Capuro-Esprevedoro and Joshua Greenberg, both PhDs. They completed an in-depth synthesis of recent research and evidence in the field of health and risk communications, just to inform future planning and capacity building. So they look at peer-reviewed studies and great literature on health risk communication in the past decade, and we looked at what they found, and they came to group it under 5 major pillars. So the first pillar is transparency, trust, and uncertainty. So at that point, transparency should go beyond information disclosure to acknowledge uncertainty and explain how decisions are made. So that's a best practice from a communicator standpoint. And that organization should aim to be transparent, but also to be perceived as transparent. So when you do have information available, do offer it. Additionally, stating clearly what is currently known and not known is better than saying nothing. So that's part of building trust in the literature that they found. It really matters who is saying the message. It has to be from a trusted source. Another pillar which they found that we're currently working with right now is within conspiracy theories, misinformation, and disinformation. So regarding that, updating guidance with new scientific evidence justifies a shift in position, that's okay. People are really hesitant to change or say, we've changed our position on this. But when we do discover new information, we can offer that to the public, and that actually builds trust, especially if you can provide the evidence which has led to these policy changes. And we've seen during health crises, conspiracy theories, misinformation, they all resonate with public fear and emotions. And they circulate pretty easily, especially on social media. Another point is to acknowledge scientific uncertainty. You can explain that you don't know what you know. That's a lot of it too, is there's this expectation previously to be perfect. We can admit that we're still researching or we're still finding new information. And it's important to say that, because that again builds trust. You're not being the be all and end all to many things. So that is another best practice that we would support. And then some other very basics: detect and correct, use trusted sources, like scientists, subject matter experts are highly recommended. Instead of spokespeople or figureheads, choose someone who's an expert of the topic, and say what you know when you know it. As Melissa had mentioned previously, media fragmentation is something that we've seen. So you might see different corporations that own different media conglomerates across the world, and they're buying up the smaller rural papers, and so everyone is getting less local news. We're also seeing people are not all watching the same news channel, if they are even watching the news at night. So there's media fragmentation for sure, which is playing a role in how people are receiving information and how we're disseminating any information that might be relevant for them. So during a crisis, it's important to be available as possible, have a very agile media relations team that can help support that and help provide information when there are questions, or at least provide a resource for people to ask the questions to. Social media is changing significantly, especially within this past year. And what they've seen in terms of best practices in our gray paper is communicating the full scope of the risk or crisis. We can monitor health conversations or science conversations online. So how do people speak about agriculture? How do they speak about new developments in the sector? What platforms are they speaking on? And looking at audience behavior, making sure that you're investing the right time and energy in the right platforms, based on where your audience is, because not everyone's audience is on Instagram. And then risk in communications for disenfranchised populations. So health inequities, disadvantaged Indigenous peoples, refugees, new immigrants, racial, sexual minorities, people living with disabilities, a whole wealth of our population. And if communities mistrust the authorities, we found that they will be less likely to follow advice and engage in risk prevention. So for us at CFIA, that could be a barrier to a successful policy implementation related to the agency's mandate. It doesn't matter what we communicate if they don't trust us. So we really have to pay attention and to have an understanding of the different communities and audiences that we're trying to speak to, and how they like to receive their information, and how they understand it. So to sum it all up, we really appreciated the work done by our colleagues at Carleton University. And they really summed it all up to say, be transparent with what you know is better than saying nothing. Explain how decisions are made, what led to a certain policy change, communicate the full scope, acknowledge uncertainty, and monitor the news cycle and conversation to learn about your audience and what they need or what information they're looking for. Also work with our stakeholders and partners to, amplify trustworthy messages. So don't be afraid to share partner messages. It's always appreciated, and continue to build and maintain trust by showing evidence when you are presenting information or policy changes as a part of good risk communications. So lastly, before I hand it back over to Melissa, just regarding risk communications at the CFIA, at the agency itself. So it's very much a work in progress, as is anywhere. We're working on many diverse files and interconnected topics, from invasive insects and plants to food safety and animal health. We're trying to establish a One Health approach. It takes a lot of coordination, and we've had some successes so far in terms of communicating One Health related policies. So for example, in summer 2022, we worked on risk communications for the new measure that was prohibiting the entry of commercial dogs from countries at high risk of rabies. So we work really closely with both the subject matter experts, but also stakeholders including, rescue organizations and veterinarians. And by working closely with these groups, we're able to understand what the concerns were, better communicate, and get all that factual information out to Canadians so that they could understand why we were making this policy. So while there are those that do oppose our policies at times, we work and we do our best to provide the reasoning behind why we're doing this, and show why we're putting these regulations in place. And that's our job as communicators, is to show the why. Another example from last year was Canadian Thanksgiving. We were experiencing significant avian influenza outbreaks across Canada, as we are unfortunately now. And there were conditions on export products regarding the United States import. So we knew that our cross-border shoppers, we do have a segment of our population that lives close to the borders that do shopping, would be impacted. In addition, if there were, families or people crossing the border either side to celebrate the holidays. So for that, we worked ahead of time to inform our cross-border shoppers by working with our colleagues with our partner agency, the Canadian Border Services Agency, CFSIN. We were able to put together a whole communications campaign. We did proactive media relations and interviews with spokespeople, targeting regions in Canada that were near border towns. We also put together a paid advertisement campaign that was targeted geographically. So that was a part of us really trying to make, not all Canadians needed to know about these regulations, but Canadians in those geographical regions did. So we did our best to get that information out. And that, prevented food waste from people having to grow their food at the border, but also help support, cost of living, because people would be also upset about having to spend and lose their investment. And then lastly, before I hand it over, there was also infant formula recalls in 2023 impacting Canadians across the country. We collaborated really closely with our Health Canada colleagues and other stakeholders to ensure that those who needed to have the information had it, mostly parents of infants. So through this experience, we did realize that while we needed to adhere to our mandate, we also needed to take a more holistic, strategic approach and consider risk outside of our mandate. So in this case, it had an impact on supply, given shortage, and it became a food security issue in addition to both a safety issue. So all this being said, we still have a long way to go in terms of consistently applying risk communications at the agency and with our partners, but we have established a few best practices that we do think make a difference. So I'll hand it back over to Melissa.
Great, thanks, Jessica. So as Jessica mentioned, here's kind of our top 4 best practices for health and science communications. It's kind of some basics that help support the foundations of risk communications. So the first one is identify and prepare for risks before they happen. Easy, right? But ideally, if you can help your communications advisors identify the risks before they happen, think long-term, short-term, what is the future of the program or policy, or as far as you can see. Anything you're hearing from your stakeholders on that potential issue is really important. Is the changing climate going to be a problem for this issue? How so? So then your communications folks can help you coordinate messaging between other government departments as well, if that's required, or partner organizations. This also stems into developing tailored content. So you can manage risk by making strategic choices about content and themes. Prepare to adjust products to evolve with changing narratives, themes in social and media, as well as changing science and risk, which is most likely going to happen. It's important to work closely with your communications folks as well as subject matter experts to ensure that the content is appropriate for the intended audience. And to be effective, communications must be timely and relevant and provide a clear and concise message. I know this is something that we're repeating throughout this presentation, but something that's very important to keep in mind. The second is about assembling the right team. So as communications advisors, sometimes speaking from experience, what we see with our agency is that different areas work on the same topic, but different areas from that topic. So for example, vaccination is one area, import export is another area, but it's about bringing those people together and assembling that right team so everyone's at the table. For communications, it's ideal if you can have one point of contact for us. So to have that coordination liaison, it's increasingly important. So we are aware of what's happening across the department on that one topic, because no matter if you think that it doesn't affect the issue that's in the media or whatnot, it is most likely going to connect at some point. So if your communications advisors know right from the get-go what everyone is working on, we can help build that narrative. We understand that coordination of files that impact various groups can be extremely complicated, but this helps us ensure that communications remain holistic, aligned, and done efficiently. This also includes, in terms of building that right team, regular and productive engagement with either other government departments or even partners, right? If you engage regularly as part of interdepartmental meetings, they can help review content. It creates an opportunity to coordinate efforts, collaborate, share knowledge, and amplify everyone's content so that you're all saying the same cohesive message. The third is audience identification. At the beginning of the planning process, identify who you're trying to reach and where you'll be able to reach them. It's important to identify the so what. So who is your audience? Why should they care? How it will impact them? Get to the heart of the matter. Why should your audience care about the issue at hand? And if I repeat these in presentations, but think of it as we live in an individualistic society where it's all about how you will react to something. And while we're working towards messaging for a work perspective, think about in your individual lives how you deal with the information that come to you. You're not going to react the same way. So it's very important to think about, okay, how will my audience react to that? And why should they care? So think about it from that lens. The now what? So when we inform audiences, we need to let them know what we expect from them. You need to have a clear call to action. Do you want them to just get more information on a website? Is it to vote? Is it to actually make a difference in their lives? So if you're trying to get them to get vaccinated, for an example, that's a broader discussion, but it's not telling them to get vaccinated. You have to be clear about why they should get vaccinated and kind of the risks if they don't. So it's a very meticulous approach where you have to keep in mind that not everyone will react the same way to your message. And then what are the next steps? Don't let it die, right? If you're trying to have those communications about risk, don't just go out with one message. You have to kind of create that momentum, sustain that messaging. So prepare to provide updates, keep that audience up to date. At the agency, we have subject matter experts and well-respected scientists that we can use and put forth in front, either in front of proactive media outreach, or perhaps there's podcasts out there. We can try to reach folks that way through our scientists. So we need to use the resources we have to build trust and support messaging. And finally, aim to provide content in plain language. Might seem obvious, but the information has to be accessible and easily comprehensible. Remember that we're working to communicate to key audiences and those most impacted. So at times, as communications, we do have to simplify language and reduce that complex topic to something that's more digestible. We need to balance that scientific accuracy by providing timely information to Canadians or to your audience about risks. And just because it's perfectly accurate doesn't mean it's perfectly understood. While you can send out the message that most scientifically perfect accuracy, if your audience is not understanding your message, it's failed regardless. So with that, the next slide kind of brings us back to something I mentioned in the beginning of the presentation about having some resources that you can check out. These are great, and we do encourage you to look further into the work that has already been completed. And finally, the last one, these are just kind of questions to help guide the discussion. If you have questions for us, or perhaps something that we can discuss offline, while of course we welcome questions on what we've shared with you today, this is a two-way dialogue. We do want to share with everyone what we've learned, but we'd also love to learn from you, kind of what are your challenges, any success stories that how you've successfully applied risk communications to your work. And if you ever have any questions following the webinar on this topic, we'd be happy to respond or help in any way we can. Just reach out to our technical cooperation unit and we can be in touch. So thanks everyone for listening in.
Thank you very much, Melissa and Jessica. And thank you, Melissa, for the quick messaging also on the work that the unit does and on any follow-up that is needed. We do have times for some questions. I haven't seen anything in the chat. Usually I find when there's no question, it's because the presenters are doing a very good job in presenting in a very clear manner, which was the case today. So feel free to add your questions in the chat. And I will take the opportunity also to mention that we will put a quick link for a survey in the chat if you want to take a few minutes to give us your comment on the content of the webinar you saw today, or even the format. This is always something we appreciate, to see feedbacks and to hear what people have to suggest, so that we can continue to improve and do a better job every time. I will also mention, again, as I said at the beginning, if there's any topic of interest in relation to what CFIA does, or anything you would like to learn from us, feel free to reach out, and we would be happy to put together a webinar just like today's webinar. So seeing no question, I think maybe Jean-Charles, I would like to invite you, if you want to say a few words, our ICA colleagues.
Well, big thank you to Melissa and Penelope. The very clear presentations. They're amazing tools. It's a bit unfortunate that you're not kind of ready to be able to accept the international partners to be able to use the tool. That's kind of in the chat, at least, that was the reaction immediately. Like, I want to use it. Oh, not yet. Okay. And no, I mean, but it's a great model, and maybe explain when you talk to people outside Canada, when you say FPT or PTs, like they won't get that right away. So maybe explain provinces and territories and how that works. But otherwise, I've really enjoyed the presentations. Obviously, solid and amazing tools. On the risk communication side, very valuable assets for this country to overall, as a package, manage food safety in Canada as a leading country, according to some reports, tied with Ireland. I remember some years ago, as #1 in terms of food safety systems in the planet. Great job. And I don't have any additional questions. I wanted to thank our team here at ICA Canada in Ottawa for organizing all the logistics. My thanks to, obviously, the CFIA for excellent speakers, and Marie-Pierre for her support and regular partnership throughout the year. We will come back to you with, we intend to have another webinar or two next year with CFIA, and a workshop on African swine fever. My thanks to the interpreters again for their support in English, French, and Spanish in Costa Rica. And it's snowing here in Ottawa, so any extra warmth out of Costa Rica will be welcome up north here. But seriously, good job, everyone. I've enjoyed I hope that the audience have found it of use, and just to say thanks again to CFIA, and to wish everyone a great day.
Thank you, Jean-Charles. It was a pleasure today to be with you, everyone. I echo Jean-Charles' comment on the big thank you to the interpreters. Big thank you also to the presenters. And we will be in touch shortly for more collaboration with ICA on those webinars. Thank you very much, everybody.
Thank you.
Thank you.
Take care.